Hey, today we're here to talk about right-sided heart failure and atrial fibrillation, also known as A-Fib. So my patient today is, once again, my husband. How are you doing?
Good.
Okay. So some of the things that you may see in the general health history of a patient with either of these is they'll complain of being short of breath or having an inability to exercise. They may have a history of coughing and decreased concentration skills, but also just generalized weakness and, again, history of shortness of breath. Do you have any complaints today? Okay, good. One of the things you may see in the general appearance of either of these patients would be swelling of the lower extremities, which I do know my husband has sometimes, pale skin, weight gain due to the edema. You may also see fatigue, weakness, like I mentioned, and also still the dizziness. Excuse me. Okay. So on these particular patients, when you go to inspect their chest area or their abdomen, lungs, this situation, you may see things like chest pain if they have A-Fib, but also in both of these you will still see the shortness of breath. So I'm going to listen to your lungs real quick and just kind of get an idea of how your lungs sound. You've not been short of breath today, have you? Okay. Alright, will you lean forward just a little bit? Thank you. Just, here you go. One more. One more. Okay, good. One thing that you may see when somebody with either of these is when you go to inspect the posterior side here, when they breathe in, your hands may not separate as much as they should. May do just very little or not at all. You okay if you lean forward just a little bit? Alright, deep breath in. And down. Alright, good. Thank you. Can I see your nails? In these patients, their capillary refill, depending on their circulation, could be really quick, but also really slow. Typically, you want to see 2 to 3 seconds, but in these patients, they could be 4 to 5 seconds. You're good. Excuse me. You okay?
Yes.
I'm just kind of feeling around right now. Alright, I'm going to listen to your heart real fast. You don't have to do anything, you can just sit there. And we'll lift your arm. There you go. Okay, you're good. So in a patient with A-Fib, you may hear a third heart sound, which is not very normal, or you may hear it beat really fast, so you may not catch it. In a heart failure patient, you may have the opposite. You may hear the heart beat one time for the atriums, but not for the ventricle. That's pretty normal in either of these. Can I see your arm for your pulse? And again, a heart failure patient may have a slower pulse, but then an A-Fib patient will have a more rapid one. Yours is pretty strong. Okay, thank you. Excuse me. So also with this portion, you also have to inspect the abdomen area. In a patient with heart failure, especially the right-sided heart failure, you could feel things like an enlarged liver. You may notice just extra fluid around the abdomen area. Again, edema, swelling, which that leads to the weight gain. You okay with me listening? And okay. So I'm just going to listen to his abdomen to make sure that he's got all normal sounds and nothing's not sitting around. Which arm? Okay, good. Anytime that you do an abdomen assessment, you always want to inspect it first, then auscultate, and then do your percussion and palpation last. Because if you do either of those before you auscultate, you could like move things around and you'll hear sounds that you may or may not need to hear. But also with, like I mentioned, the heart failure patient, you may feel an enlarged liver. So to feel for that, you would just kind of palpate around here. You would do a light palpation and then a more deep one, but not enough to hurt them. Let's see. One thing that I forgot to mention is when you are listening to your heart, you need to make sure that you note which heart sounds that you are hearing. Because again, if you hear anything that's out of the normal, document it and let the provider know. That way they can maybe do further testing. But that pretty much concludes the heart failure and A-Fib assessment that we can do today. All right, have a good one.